Welcome everyone to ERISA Fiduciary Governance, Part 2. Let's talk transparency obligations. Thank you all so much for joining us. The benefits compliance team will be answering the questions that you send through the Q&A today. We'll try our best to answer all of your questions, but if for whatever reason we're unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We'll be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday you receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'll hand it over to Chase Cannon, Senior Vice President and Deputy Chief Compliance Officer of Benefits Compliance at NFP, Carol Wood, Vice President and Counsel of Benefits Compliance at NFP, and Heidi Caudle, Senior Vice President of Cost Containment Strategies at NFP. Chase, the floor is yours.
Thank you so much, Amber, and thank you everybody for joining us today in our second part of a four-part series focused on ERISA fiduciary governance. And today we're going to focus on our transparency obligations and how those play in for fiduciary governance. Before we get started, just really quickly, a quick note that the following is intended to be used for general guidance purposes only, not intended to constitute tax or legal advice. And any question relating to the application of the law should be addressed to your own legal or tax counsel. And our information is correct as of May 21st, 2025. That is today. So just a quick disclaimer there. I wanted to give a quick introduction to myself. I'm Chase, been with NFP for about 15 years now and lead out on our compliance team. You've probably heard my voice on these webinars before. Carol Wood is a member of the benefits compliance team. A wonderful asset and is focused on so many different things, but particularly ERISA fiduciary governance, has spent a lot of time over the last year and a half or so focused on that, and a lot of time in her career focused on that. And you've probably heard Carol's voice as well on these webinars. Heidi is a special guest joining us, and we're so excited to have her perspective on this call. And Heidi, if you wouldn't mind just taking a minute or so to introduce yourself, a fellow University of Utah graduate, which makes me happy. But can you just talk a little bit about your role at NFP and your focus in the work that you do?
Yeah, Chase, really appreciate the opportunity of being here with all of you today to talk about this important topic. The purpose of me being on the call as we talk about transparency, etc. I've been with NFP about 12 years in my current role in leading cost containment strategies, and some of the transparency initiatives has been the last 6 years. So have worked very closely with Chase and team on really taking the other side of the equation of obviously the compliance team focusing on the compliance and the legal aspects of it. But I really work, and my team really works very diligently to empower clients with resources and develop different tools to be able to meet some of the obligations that you find yourself in with these new transparency laws. So today I'm going to share a couple of those with you as a positive anecdote to all of the compliancy, and not to underestimate all the compliancy needs, but there really are some favorable things that are coming out of this legislation that will empower you with information that you haven't had before. So Chase, let me turn it back to you and let you get started on the compliance.
Yeah, thanks, Heidi. Great intro. We're glad you're on the call. And as we look at our agenda today, and as we were building this, we decided that this presentation is going to get progressively more and more interesting, because the more and more Heidi kind of gets into those tools and resources, the more excited you're going to be to kind of see what we can do with those as they relate to fiduciary governance. And so we're going to go do a couple of quick reviews on the governance basics and the health plan transparency rules, the obligations of employers quickly. And then Carol's going to walk a little bit more in depth on how those relate specifically to fiduciary governance. And then we'll start getting into some of those strategies, the cost containment tools that plan fiduciaries can use. So hang tight with us at the beginning of this. It'll feel maybe, particularly if you're on the first edition of our fiduciary governance webinars, and if you've seen our toolkit, our resources on this, This will be a little bit of a review, but I do want to say for this, we're going to talk a little bit about the basics here. We do have a really nice toolkit and publication with that outlines a lot of these steps that employers should be taking in more depth. And please ask your NFP representative for that if you don't have it and you're on this call. But we're going to go quickly through these. But really, when we're talking about ERISA fiduciary governance, this is not necessarily a new topic, but it's kind of been reintroduced and re-highlighted based on some litigation and some new rules with the transparency. And we're going to talk about that in just a sec, but this is a general ERISA principle. I kind of think of it as when you say the word fiduciary as a synonym for heightened responsibility. And so really this idea of doing the best you can to make prudent decisions and to make wise decisions that are in the best interest of plan participants and beneficiaries in each step and in each decision you make relating to the plan. And so if we're thinking generally, employers, really, this is a proactive approach. It's not a one-size-fits-all approach. And it's really dependent on your governance structure, generally, your policies, your procedures. And that's going to be based on your size, needs, and complexities relating to your specific benefit plans and your plan strategies. Outside counsel, ERISA counsel is always advisable, particularly if you're in the self-insured space. We'll get there in just a second, the difference between fully versus self-insured. But those are some general guiding principles. When we're talking about specific practical steps in establishing a fiduciary governance program, I'll go through these quickly. But again, on our last webinar, we went in depth on these, and you can find that webinar at nfp.com on our Insights tab, or reach out to your NFP representative again. But quickly, the first step is really identifying your plan fiduciaries. That fiduciary is really any party with discretionary authority over the plan or plan assets. Consider who will fulfill the plan administrator or that named fiduciary role and ensure the appointment is documented. Those are important first steps. The second step is really understanding the basic ERISA standards for fiduciary conduct. And I just mentioned those. Prudence and diligence of a prudent expert, kind of operating, following the plan document terms and acting solely in the interest of participants. We call that the duty of loyalty, with care, skill, prudence, and diligence of an expert. And that's considered the duty of prudence. So really understanding those, again, by being on this webinar, you're getting some of that education, but understanding what that looks like is key. The duty of prudence focuses on how fiduciary decisions are made and engagement in the prudent decision-making process. So this is not kind of a one-time check the box type of compliance thinking. This is really an ongoing process in each decision that you make. The third step would be reviewing the fiduciary governance structure. For more sophisticated clients in the in the self-insured space, consider establishing a committee. Now, a committee is not needed for every plan everywhere, but it may help employers facilitate and document their decision-making processes, and can also help limit some of the fiduciary liability exposure for the employer and board of directors. Oftentimes, the board of directors is kind of the default fiduciary if they're the ones that are making decisions or delegating that. Prudent process for making and documenting fiduciary decisions. This is really, whoever's involved with plan-related decisions, meeting regularly, documenting, discussing those decisions, engaging experts as needed, and making sure regular training happens there. And then documentation, again, is key in that prudent decision-making process. Recognizing that selecting and monitoring service providers is a big part of this, and engaging in a prudent documented process. Again, we talked more in depth on this, but that can include RFPs to make sure you are getting the best deal and the best providers, and then monitoring throughout the process, monitoring throughout the plan year, to make sure that the service provider is doing what they say. And then fiduciary liability insurance and indemnification can be another tool to help protect plan fiduciaries. So those are kind of the basic steps. Again, we have this outlined in our publication. We have really helpful tools to help with some of those steps, sample meeting minutes, sample committee member formation documents, and education documents to help those that are making these decisions understand their responsibilities and what those look like. Fully insured versus self-insured. This is a big deal, right? Fully insured, and we probably have a lot of both of these on the call here. If you're fully insured, really your fiduciary duties are shared with the carrier, and the carrier is going to play a significant role in compliance. And we listed here, and we're not going to go through each of these, but kind of the primary concerns to be focused on when it comes to those 6 steps that we just talked about. For a self-insured employer, you have a little bit more fiduciary responsibility, and you have more involvement in the plan decision making, and therefore you're going to have more steps to develop an appropriate governance program. So the employer, really, you have to take the primary role in compliance. You can work closely with TPAs and vendors, but your laundry list of things to do is a little bit longer there. And again, we're not going to go specific into the details. A lot of what we're talking about with transparency is going to be more focused on our self-insured employer clients that are on the call today, or anybody who's listening that's self-insured, just because you have more involvement in that decision-making process. So with that, we're going to look quickly at the transparency laws. So we kind of have a structure of what a governance program looks like, differences between fully and self-insured. Let's look at our focus on today's call is going to be on how these transparency laws impact our fiduciary governance obligations and thinking. Really thinking quickly here with transparency, the idea behind transparency laws is to address rising healthcare costs and the lack of information that's available to plans participants in making informed healthcare choices, trying to remove some of the barriers that are there to get network rates, quality of care information, access to mental health benefits. These are focuses in trying to remove those barriers. Promoting greater transparency in healthcare pricing and billing, and ultimately creating a more competitive healthcare marketplace, really trying to put that downward pressure on prices. And so that's really the focus. We listed the laws on the left there, but this is kind of the purpose of the laws, right? So important to understand why we have those. Why are those important for group health plan sponsors? Well, lack of transparency has made it difficult for you as the plan sponsor to obtain the information necessary to make really good decisions, right? And you have the fiduciary duty to make sure you're to do those decisions in a prudent way. Again, listed here, ensuring plan assets are administered prudently and solely in the interest of participants, monitoring plan service providers, verifying that service provider comp is reasonable. And so you need access to healthcare costs, claims data, service provider information, and particularly heightened there for self-insured plans where those you assume greater financial responsibility. So the good news is that with this transparency laws is that we have some of these tools. They're now available that help publicly disclose some of this pricing data. This is all helpful if we can get our arms around it and understand it, right? It's going to help you make better decisions. It's going to help you to be able to reduce risks. But gathering it all is kind of what we're going to be talking about today. As far as which transparency laws we're focusing on, this is more of a detailed, nuanced slide, but we're looking really at a transparency and coverage rule. You'll hear that referred to as the TIC rule that was enacted in November of 2020. And then we have the CAA 2021, which is really focused more on numerous requirements that are probably familiar with our gag clause prohibitions, the comparative analysis for mental health parity, NQTLs, We're going to talk about each of those right now with Carol. So I'm going to flip it over to you, Carol, to go a little bit more in depth on some of these transparency rules and really focus on the ones that our audience in considering and establishing their fiduciary programs needs to focus on.
Sure. Thank you so much, Chase. That was a great introduction. And as you said, I think the exciting part of all this is that for all these compliance burdens, which bear with me, I'll be discussing in the next section, for all these measures that we're taking to meet these reporting, posting, and all these obligations, we are now achieving some of the results that these laws were aimed to achieve. And Heidi is part of that process with her tools. So that's the good news, and that's coming. But I'll just ask that you bear with me through this next section, because we do have some important updates to the CAA transparency requirements, many of them taking place this year with the new administration. So I want to start with the gag clause provision, which is actually one of the most important provisions, and that's how I first met Heidi, because it was necessary. The regulators realized to have gag clauses removed from contracts. These are provisions in contracts that would restrict the plan fiduciary from having access to provider-specific cost and quality of care information, and providing that to participants. You need to know what the plan prices are to do your job, and to be able to compare them. Electronically accessing de-identified participant claims information and data. And this is super important. And I think employers often don't realize what that's all about until they actually need the information. If you are a self-funded employer, maybe you want to do a claims audit, a claims analysis, some type of a price comparison. People like Heidi are involved with that. Maybe you need the information for your mental health parity comparative analysis. You want to make sure there's nothing in that contract that's going to block you from receiving that information or sharing it with a business associate who'll be assisting you, in that project that you're undertaking to fulfill your obligations. And we know we have to attest annually each year by December 31st, can be done at any point in the year. And we did have some new guidance. This timing was kind of strange. It came out in January of this year. Informal guidance, there are FAQs. The second set, we had a prior one in 2023. And just a few points here. The guidance indicated that plan sponsors need to be careful that when they enter a contract, let's say with a TPA, that the TPA is providing assurances that they're not entering any downstream, we call them contracts, that have gag clauses that will prohibit the sponsor from accessing information. So you enter a contract with your TPA and you review it yourself, which is definitely recommended if you can review the contract for gag clauses, or you receive an assurance that that contract has no gag clauses in it from the TPA. But if the TPA has gone and entered a contract with a network provider that won't allow the TPA to share that information with you, then that's a prohibited gag clause. And the guidance is saying that you as the plan sponsor are then responsible for that. That's considered you violated the gag clause provision. So just as you're entering contracts with different providers, you want to make sure that they're giving you that written confirmation that there are no gag clauses in any of those downstream contracts. The FAQs also provide helpful examples of gag clauses with having to do with de-identified claims data. There are many. There are still I-review contracts, and unfortunately, we still see gag clauses in many contracts, so it's still a bit of a battle. But it's really any provision that would limit the ability to access that de-identified claims data in terms of the scope or scale or frequency with which you can do it. And then finally, there was a provision that requires plans to report non-compliant contract clauses on the attestation itself in the additional information box that was added. And I think the idea behind this, quite honestly, was that regulators, the government was concerned that there wasn't enough enforcement in this area. I don't know if it was particularly aimed at plan sponsors, but they likely were aware that there are still gag clauses in contracts, and TPAs have not completely removed them, and they cannot regulate TPAs directly. So through the plan sponsor, they want the sponsor to report if they have been unsuccessful in getting a TPA or other service provider to remove the gag clause. And obviously, you should always make every effort to get a gag clause removed if you run into that situation. But we would advise before you report anything on your attestation to speak with your own counsel to make sure all necessary measures have been taken, because you're essentially stating that you've prohibited the gag clause provision, although the measures you took to remove it would be taken into account. So just be aware of those updates. Okay, now the mental health parity comparative analysis. This has been a real challenge, perhaps the biggest challenge for many employers in terms of their compliance with the CAA. And we received guidance just in the past week. So to review, we know that the CAA enhanced mental health parity requirements and with a focus particularly on non-quantitative treatment limitations. There are many of these. Examples are pre-authorization requirements, step therapy protocols, experimental treatment exclusions, standards for provider admission to a network. We could go on. But what was specifically required is that plans perform and document a written analysis of the design and application of those NQTLs imposed on mental health and substance use disorder benefits as compared to those imposed on medical and surgical benefits to show parity. And this analysis had to be available if requested by a regulator or even a participant, like the participant could request a plan document upon request. Last year, I believe it was in September, final rules were issued, and among other things, they required that the plan fiduciary certify that they engage in a prudent process to select a qualified service provider to perform the analysis. I know this raised a lot of concerns among plan sponsors, understandably, because they were not necessarily able and intimately involved with the creation of this comparative analysis, but they have access to the information to even verify all of the accuracy very easily. So there were also a number of other concerns with the regulations that in issuing them, the government had gone beyond their statutory authority, among other claims. So in January of this year, the ERISA Industry Committee, known as ERIC, a trade association that represents large employers, sued the federal government and claimed that these 2024 regulations exceeded the administration's authority. They were going to increase costs, and they actually risk reducing the quality of care. So they're arguing very sophisticated complaint, very well written, but they're basically arguing the burdens of compliance, outweigh the benefits. And perhaps many plan sponsors feel that way. On May 12th of this year, a judge, now we have a new administration coming in, granted the Trump administration's request to pause that lawsuit while they reviewed those 2024 regulations, and they're considering potentially rescinding or modifying them. And this review of the regulations was part of a more general effort that the new administration was taking on. It wasn't really specific to the MAPIA regulations, although they were included in that process. Just to make sure that these that the regulations make sense, that they're not overly burdensome on small businesses and in this case sponsors. So a statement was issued on May 15th that was expected, saying that the administration is not going to enforce the new rules pending their review of the regulations, and they're actually not going to enforce them until then a final decision is made in the lawsuit, if that does proceed forward after the regulations are reviewed, and for a period of time after. What does this all mean for plan fiduciaries? Basically, they're still required to comply with the comparative analysis requirements, but the new rules and that fiduciary certification are not going to be enforced during this interim period. Next slide. Okay, RxDC reporting. We have a deadline coming up on June 1st, and this, of course, requires health plans and insurers to submit a lot of detailed data about prescription drugs and healthcare spending to CMS. And it's most plan sponsors coordinate with their insurers and TPAs and PBMs and other service providers to submit the information. And then the purpose of this was that the regulators would receive and review the data that was collected and then compile it in a report that would show nationwide trends regarding prescription drugs, reimbursements, pricing trends, and specifically the role of drug costs in contributing to premium rates, which has been a concern. The first report was issued that was really long overdue. The government was late of 2020 and 2021 data in November of 2024. And quite frankly, it was disappointing. The report didn't provide really any plan level insights into prescription drug pricing, in part because of the data was aggregated by TPAs and PBMs, and really few relevant conclusions could be drawn from it. It didn't determine, as had been an aim, the role of prescription price changes on premium rates. So the agencies are considering ways to make the data more useful. Maybe we'll see some guidance on this going forward. However, you are still required, of course, to comply, and we have that deadline coming up June 1st. So be aware of that, and maybe we'll see, some new guidance coming out on this later this year or next year. Next slide. Service provider compensation disclosures. I think it's really important to focus more on this particular requirement. There's an obligation imposed on your service providers, stated here, a party providing brokerage or consulting service to a group health plan is required to provide a written disclosure to the responsible plan fiduciary of any direct or indirect compensation they'll receive for their services. And it applies in most cases if the provider is going to receive $1,000 or more in compensation. And it has to specify the services on the all expected compensation. Any notice of fees has to be provided within 60 days. And we haven't had any regulations on this yet. We've only had some informal guidance that was helpful, but not regulations. And I would point out that in the retirements sphere, rules and regulations were issued and went into effect all the way back in 2012. And it is helpful to have regulations, but thus far we just have informal guidance. And these disclosures, importantly, they're designed to actually assist you as the plan fiduciary to fulfill your obligation to determine if the service provider's compensation is reasonable and for necessary plan services, and also to identify potential conflicts of interest. Otherwise, the transaction is prohibited. You're entering a transaction with a service provider is a prohibited transaction. It's an exemption that allows you to do that and not go afoul of the law, your fiduciary requirements, if the service provider's compensation is reasonable and for necessary plan services. And also with this different requirement, the disclosure has to be received. So it's so important to make sure that you're receiving and documenting receipt of these disclosures so you're not engaging in a prohibited transaction. Next slide. Okay, we did have an update on the service provider compensation disclosures. And I think this is important. The Trump administration issued an executive order, and this actually requires the DOL to propose regulations within 180 days, and that would bring us to sometime in mid-October to provide greater clarity for health plan fiduciaries regarding specifically compensation received by PBMs. So that was the focus of drug pricing with this order and the PBM compensation. However, there's speculation that those regulations will also address other types of brokerage and consulting compensation that are covered by these disclosures. So we'll have to wait and see what's in them, but I think that may be helpful to plan fiduciaries. There are unfortunately lawsuits, and Chase will be speaking of these momentarily, that focus on service provider compensation, alleging sponsors who has a plan to engage in a prohibited transaction by overpaying their service providers. So this is all the more reason that employers really need to ensure they have a prudent process in place for these ongoing prohibited transaction, 408(b)(2) compliance. Important to review your contracts, determine when they renew or be extended. So you're looking for these disclosures in advance. Requested, if not provided, before entering, extending, or renewing that contract. Review disclosure and fees for accuracy and reasonableness. And if needed, send a written request to the provider for clarification. And I point out the question we're often asked then is, well, how do we determine that reasonableness? Of course, you can go out to an RFP, and that's probably the best way to do it to get that other pricing, but plans don't necessarily do that or do that every year. And I think that's something that the tools that Heidi has helped to address, at least in the medical sphere. It gives you that basis for comparison that I think many employers are looking for. Of course, engage independent experts as necessary to evaluate proposed fees and contract terms. PBM contracts, for example, can be very complicated. Make sure you understand the fee structure and the terms. And of course, document the process, retain a copy of the disclosure, and have that for record keeping purposes. And with that, Chase, I'm going to turn
Yeah,
it
I think this
over
is
to
really
you.
an important slide and part of the process, right? And when you're talking about reasonableness, it doesn't always mean you're going with the cheapest option, right? You have to weigh lots of different things there, and the cheapest might not be the most prudent. But lots of things to consider when you're kind of going through this process.
Yeah, and I'm sure employers actually are doing it, Chase. I think it's just important to make sure you're formalizing it if you're not already.
Right. Yeah. Documenting your decisions. Why did you get to the decision that you got to? And that's all going to help you when it comes to the litigation, which we're going to talk about next, right?
Okay, yes, and I'll turn it back over to you then.
Yeah, thanks. So we'll go quickly through this. We have talked about these lawsuits on past calls. I want to, get further down the road in looking at some of this. So several different lawsuits out there that we're tracking. But I guess one key takeaway so far, participants have not really been successful in showing that they have suffered a personal and concrete injury. We call this the requirement to establish standing in a case. And so on the health and welfare side, with these cases that are being filed, we really haven't seen that. But that doesn't mean the lawsuits are going to go away, right? There's going to be, and if we look at this next slide that kind of has the three of the primary cases, I think all are filed by the same law firm, just trying to latch on to the same type of claims. So a couple, probably the most famous case that we've heard of is Johnson & Johnson. New plaintiff there that added an amended complaint filed back in March. So we're waiting for the court to rule on J&J's motion to dismiss that amended complaint. Again, this is all about whether the person that filed the complaint, the participant, really has standing, where they actually hurt. And it's kind of the same idea for this Wells Fargo and JP Morgan case. One case, so I guess takeaway here is no huge changes from these court cases where we can really have some clear guidance or any type of guidelines on how an employer can structure their governance program to avoid the lawsuit, right? Which I think is what most people are kind of looking for. Also looking for from the employer side, making sure that they understand, the lawsuits generally. But there is one case that's actually on the retirement side that you may have heard of recently, Cunningham versus Cornell University. A lot of people just refer to it as Cunningham. Again, this is on the retirement side, so it's not directly applicable to health and welfare plans, but basically this case loosened, just trying to put it in layman's terms here, kind of loosened that bar to establish standing, and really says if you're entering into a transaction at all, you may have standing. And so we anticipate, particularly on the retirement side, that this will create a much easier path for plaintiffs to file lawsuits against their retirement plans. And it is unclear how this will impact group health plan litigation. But for here, it's just important to understand that bar may be going a little bit lower to be able to get involved with a lawsuit. But we still haven't seen this on the health and welfare side. So it really highlights the need for employers to, again, as Carol stated clearly, receive and carefully review service provider comp disclosures. So not any huge movement on any of these cases, but important to continue to track. We will continue to do that through our Compliance Corner newsletter. Is a good place. That's available at nfp.com on our Insights tab. And to just kind of understand, we also went further into detail on these cases in our first call. So go back and listen to that for more details. But I want to move into our transparency and coverage and then get to Heidi on some of these solutions and resources. So Carol, can you walk us through the transparency and coverage updates quickly?
Sure. Yeah, I'll do this very quickly. And I think the transparency and coverage rule, I just want to say this, I think, and I know Heidi will agree, it's really provided the most valuable data. And it's these machine readable files that we know we're posting on a monthly basis on a public site. And so far we've been posting negotiated rates for in-network items and services and those historical out-of-network bill charges and payments. So the data that comes, it's because it's plan specific, it's valuable data. That and the hospital transparency rule have really been the best sources of information for the tools that people like Heidi work with and use. You'll notice here though, I bolded the other requirement that was under the law was the prescription, the requirement to post prescription drugs, negotiated rates, and historical net prices. That has not gone into effect. That's never been implemented. There was a non-enforcement policy on that that was lifted in 2023, but we've yet to have any guidance on implementing that. And if you go to the next slide, just Chase, you want to move to the next slide there? I'll just there was a price transparency executive order that was released in February of this year, and it really focused on the transparency and coverage rule and the hospital transparency rule, which were introduced back in 2019. That was also under the first Trump administration. And the emphasis, even though the Trump administration is viewed largely as like deregulatory, this is an area that they're particularly focusing on. So the order, broad as no orders normally are, called for the DOL, HHS, and IRS to take steps within 90 days. That's by next Monday. And we're actually expecting guidance this Friday. So we don't know how specific it's going to be, but the idea was to ensure pricing information is standardized and can be compared across health plans, and to strengthen enforcement policies to ensure all the parties are complying with the reporting of complete and accurate and meaningful data, actual prices, and not just estimates. Now, many of us hope and we believe that this will include some requirements or direction on the requirement to post prescription drug prices, because I think that would be very helpful. prescription drug prices are a concern of many plan sponsors. And unfortunately, the implementation of that part of the transparency and coverage rule has been delayed. So we're hoping for that. And we're expecting to see some news on Friday. So stay tuned for that. And for more, I think we're going to see more from the Trump administration on that transparency focus. And Heidi, I'm going to turn it over to you now, and you may have comments on the executive order and how they may affect your work.
Again, Carol, thank you, and Chase for your excellent work. A couple of points of clarification. When we look at the executive order, and I'm going to stress this as we go through some of the resources and tools that we've developed to help employers, as I mentioned, fulfill some of their fiduciary obligations, is that it is specifically to medical and inpatient or outpatient pharmaceutical, which is still considered medical coverage. So we aren't able to really evaluate all of the RX retail type of costs. And that is a limitation because pharmaceutical is obviously an expense in the plan and it continues to be an expense. So we're hoping with some of the additional guidance that we get that maybe we will see some additional information along those lines because it does address prescription drug MRF posting requirements. So we're hoping for that. The other side of that, and I don't again want to diminish all of the other emphasis here, but it really does focus both on cost and quality. Meaning that as you look at your plans, that there is an element of not compromising quality of care for overall cost efficiencies. And so as we've developed some of our tools and some of the requirements, we really focus on cost and quality accountability. Okay. One other just quick clarification. When the rules say third-party administrator, it also means that your administrative service provider. So let's say you're fully insured and you decide to go self-funded, and that's with, Cigna, United Healthcare, one of the Blues plans. The TPA means an ASO relationship as well. So I don't want to just leave it with it means an independent third-party administrator. It's the services that provider, whether it's under an ASO agreement or a TPA agreement. Okay, so Chase, yeah, let's move forward quickly, and I'll cover some of the items if you'll go to the next slide. So my role and responsibility within the NFP organization is to really help design tools and resources to help employers to mitigate your fiduciary responsibility in these areas. So some of the key areas I've identified here apply to specific steps that can be taken to meet some of the obligations that both Chase and Carol have covered. When we talk about data analytics, I've always said data is an employer's first line of defense because data will tell the story. So when we talk about data analytics from a fully insured standpoint, make sure that you request and ask for, carrier, information if it's available to you. And I know that's difficult still at times, but at least request it. And so in your meetings that you're requesting this information, take meeting notes so that you have that documented to say, look, I've requested the data analytics. I'm not able to get it for these reasons, so that you have a very clear documentation process. On self-funded employers, a couple of resources that we have on a national basis is NFP has negotiated with 2 data analytics vendors that can provide more advanced data analytics like gaps in care that can help you identify areas of need that then you can address in meeting some of those fiduciary responsibilities. Because some of these lawsuits that we're seeing class action lawsuits are employees saying, my employer did not consider these things or did not look at these things. So that's why data analytics is extremely important, is to identify those areas that you may need to do a little bit further research into, or have your NFP representative do a little bit more research into, to help you to avert some of the fiduciary risk. Additionally, as we look at, vendor financial stability, this is a key area. This is where, retirement already has gone down this path of fiduciary responsibility. So we can follow some of their original roadmaps to be able to say, okay, what are key areas that the Department of Labor has already established? And financial stability is one of them. Some of the areas of looking at financial stability is that there are vendors like industry associations that already do this. Specifically, the National Association of Insurance Commissioners, NAIC, actually does a financial statement filing of fully insured carriers in that state, and you actually can have access to that at no cost. And any of the resources that I'm kind of sharing with you today, after we have completed the presentation, contact your representative and we'll be distributing some of this resource list for you. On fully insured, it's a little bit, so that's the fully insured side, because again, it's the insurance commissioners for fully insured that have oversight and responsibility legally. When we emerge into more of the self-funded or self-insured plans, there are more components, as Chase referenced. There's more elements that you need to, as a plan sponsor, plan fiduciary, have responsibility to look at. One of those elements is if you purchase stop loss, which is protection for you, let's say on an individual claim level, which is considered individual stop loss or ISL, or on an aggregate basis. Well, those stop loss or those reinsurers have also financial stability ratings. Those are done more by institutions like S&P Global, Fitch, and others. So when you hear the term, oh, it's on A+ paper, that's what that means, is that you are looking at the financial stability of the stop loss or reinsurer that's reinsuring that risk. And that's a way that you can also document that you have looked at those items. You've monitored the financial stability of those providers that are providing you reinsurance, and that's part of the documentation process. Additionally, as you look at the industry trends and where everything is going on the industry trend side, is that price transparency is gaining momentum. We are seeing enhanced focus in health and welfare evaluation and documentation process. Chase, if you'll go back, thanks. And that we're seeing that we're taking all of these different data sets. So as Carol mentioned, the laws are different for each component. We have machine readable files both for hospitals and for payers, and it's a huge data set. But what the industry has done very effectively now after a couple of years is we've made that complex data simplified. We continue to see growth and value-based competition in plan designs, which I'll mention in just a moment, and really making that data actionable. All of which, as you can see by this statement by the National Library of Medicine, which providers report into, saying, you know what, this is going to reduce expenditures overall in the healthcare industry. So Chase, if you'll go forward. So one of the key services within the NFP ecosystem that we are providing to clients is actually an actionable data tool. What we have done is we've done most of the heavy lifting that a client would do in evaluating whether your network, the network that you are contracting with, is the most cost effective. And what we have done is we have curated, so we've basically done all of the industry requirements. We've curated the clinical procedural codes, which we then map to a client's utilization. If you have utilization, we've actually designed this that in evaluating networks and what is the best performing network for you and your employees based on your locations, we've been able to curate that information and literally within a few minutes develop this 14-page report. Now, what does this 14-page report give you? It basically takes those clinical, which is basically we've taken and looked at the top 700 claims, across the U.S., across 92% of all claims that have been incurred in 2023 and now in 2024. And we've come up with this code list. We then compare basically if there was a claim, which most employers will be in that 700 procedural codes, that you can now evaluate across where your employees are located, what network would be the most cost effective or the best performing network. We have all of the national networks in the database, so PPO, EPO, HMO, and reference-based pricing. We're able to take a look at it as an index to Medicare because Medicare is a good benchmark proxy, or we're actually able to do it as actual costs. And in being able to do that, what the report shows you is basically if you have employees all across the country, all you have to do is put in your zip codes, and we're able to look at the networks that you select. So if you want to take a look at Aetna, Cigna, United Healthcare, any of the Blues plans, that we put that information into the query and we're able to generate this 14-page report. And in generating that report, now you have the information that will tell you what is the best performing network based on this price transparency information, both from hospitals and from payers. And based on these procedural codes, what is the best performing network for my employer group and my employees that are within that? That then becomes a part of your documentation process that will help mitigate your fiduciary risk. Now, if you were to go out to a private entity to do this, NFP was early in adopting price transparency data. There is no tool like this currently out there in the industry that is basically afforded to you without between a $10,000 to $20,000 investment. If you are an NFP client, this can be run for you on your behalf by one of your NFP representatives, whether from your sales side or from your client service side. So this is currently available, and I would encourage you to do this at least once annually. Do you want to move forward?
Yeah, and this is available for any size group, Heidi, or is there?
Any size group, fully insured or self-funded. Okay. So why is this important? Okay. This is an example of a real price transparency query that we have gone into our system and we have said for this specific market, which I'm not going to disclose the market, but it's for a DRG, or basically a procedural code 470, which is for major hip and knee. And we basically said, we want to take a look at the hospitals where these procedures are being performed in our market. So we had hospital A, B, and C, and we looked at it from what is Aetna's rate, what is Cigna's rate, what is Blue Cross's rate, and what is United Healthcare's rate. So this is the negotiated allowed rate for that specific procedure. And I've just highlighted in red for you an example of literally within the Aetna contracted that Aetna has not effectively contracted with Hospital C, that there's literally a $26,000 difference just on one procedure. So you can see how cost plays into the price transparency information is now available to you as an employer to look at, and we can run queries in your behalf to show you some of these things. But we also take a look at quality. So taking those same hospital A, B, and C for that specific procedure on a scale of 1 to 100, where this quality vendor is evaluating the hospital independently, that you can see that the Blue Cross rate with hospital A has a high quality score. They're still within only a couple of points of each other, but it is the lowest contracted rate. So this is how you can look at cost and quality as they're, opposite sides of the coin, but this data is now available to you. So let me go ahead and conclude and say a lot of these resources are available to you. It's also available to you when you're assessing these new value-based cost containment strategies. They're using this data to generate next generation health plans where cost and quality, you have visibility to them. You can start to steer and to tier benefits that bring incentives for your people to use these high performing narrow networks where they look at the highest quality, lowest, most reasonable cost providers. So know that this next generation of health plans is out there. It does bring control to benefit spend. You have actionable, accurate, and reliable data. It integrates some of the point solutions to bring those cost efficiencies. So know this next generation of health plans is out there that improves quality, improves access, and reduces cost. So I'm going to conclude. Go ahead, key takeaways. Chase, turn it back over to you.
Yeah, no problem. We're coming up on the end of our time, but Heidi, thanks so much for sharing all this. And this really kind of ties it all together, right? We have kind of this general idea that we have to follow these fiduciary obligations. We outlined a structure for doing that by setting up a governance program. And today we kind of went through what are the transparency rules and trying to focus on the good of them. And then the good of them is that we're getting all this information. And then through these tools that you've showed us, we can use these as, when I'm saying we, I'm talking about employers on this call, right? Can use these tools through NFP to be able to show and make those prudent decisions, right? And that's really what we're going for in today's call is how does this all kind of tie back to making and documenting good decisions. And ultimately, a lot of this is going to save costs too, which is something everybody's interested in. And also plays into the fiduciary obligation when you're talking about operating in the best interest of your plan participants, right? If you can get better costs, that's going to, and better outcomes, that's all good for your participants. So thank you so much, Heidi, for joining. As you mentioned, we just had a couple of key takeaways. And really, this is just a recap of what we've talked about today with understanding the fiduciary duties, what are the transparency, the CAA requirements. We went through those. And then, some takeaways also, understanding these cost containment tools are available. They're there to help sponsors compare healthcare prices and fulfill these duties, and focusing again on prudent selection of service providers. That's where we talked a little bit about litigation. We didn't go very far there, but that's really where a lot of this is focused. And then also looking forward, expecting greater enforcement of the transparency laws, a little counterintuitive with the current administration that's generally going towards deregulation and de-enforcement, or not enforcing certain things. That's an area where they've said that they will focus enforcement. But hopefully that results in more competitive marketplaces and lower prices. And then lastly, we mentioned this up front, but I wanted to show a screenshot and talk about our publication that's called ERISA Fiduciary Governance, a guide for employers, where we have a detailed description of those employer steps, an overview and checklist. That's the screenshot you're looking at here as an appendix, but really something to give you kind of an overview, because I know so much of this it feels so big, but hopefully this governance overview and checklist will help kind of narrow in on the particulars under each item. And then we have sample documents in there that provide, board resolution or charter, summary of committee duties if you go that route, and committee appointment letters and notice of acknowledgement, sort of how do you set up that committee if you need it, and meeting minutes. We're going to talk more about those specifics on future calls, but just highlighting that the tools to be able to do some of this are in that guide for employers. So please reach out to your NFP representative if you don't have a copy of that. Looking forward, we'd love to have you back. I know this is a lot. We know we can't get through it all on one call. We can't get through it on 4 calls, but we're trying to do our best to condense it down and get through as much as we can on 4 calls. So we have 2 more this year. Save the dates. We will be sending out invites for these, but July 16th, September 17th. These are the 3rd Wednesdays of the month. That's generally when we do our Get Wise Wednesdays here. These will all be at 3 p.m. Eastern. So keep an eye out for that. And again, we will continue to communicate updates. There's a lot going to be happening, particularly in the next week. We may be getting some guidance. We may get updates on litigation. All of that we're reporting on through our biweekly newsletter, Compliance Corner. We just sent that out yesterday. We do it every 2 weeks on a Tuesday evening. Come back to nfp.com and insights to read about that. And if you're an NFP client, you should be getting that in your email. So with that, we're past our time. I really appreciate everybody joining, and let us know through your NFP rep if you have any other questions. Amber, I'm going to just shoot it back to you to take us out.
All right. Thanks, Chase. And thank you, Carol and Heidi, as well, for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We'll be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you'll receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete the survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today. Thank you everyone for joining us, and have a great day.